This is a KX News special report.
Good afternoon, North Dakota. It's fitting we're all here today. It's World Health Day today, and it's also National Public Health Week. It's the 25th anniversary of Public Health Week, and it's the 70th anniversary of World Health Day, started in 1950. And World Health Day's theme this year is supporting nurses. I can't think of a better theme than for us as we think about all those fantastic healthcare workers that are helping us get through this global pandemic. It's also a good reminder for us to remind ourselves that the great work that's going on across North Dakota to slow the spread, it's happening here. We've got, of course, the federal guidance on 30 days to slow the spread, CDC guidelines, and what we call North Dakota SMART, which is a compilation of all of this guidance that we're talking about, which includes good hygiene, keeping physical distance, avoiding discretionary travel, demonstrating our gratitude towards all those businesses that have closed during this time, and again, now voluntarily wearing cloth face coverings or masks when in public. And again, importantly, if you're showing symptoms or feeling sick, please stay at home, contact your medical provider, discuss next steps. But and again, for older Americans and those who have serious underlying health conditions to take extra precautions to mitigate the risk of contracting the deadly coronavirus. And again, thank you all for doing this. We know that your collective work, the individual responsibility that you're all demonstrating is working, and that's why we're seeing such good result in our numbers. And let me just start again on strategy. The whole point in any state is to, whether it's any kind of restrictive orders, business closures, changing how education is delivered by closing physical school buildings but keeping education going, all of that is designed to try to slow the spread. That's what it's designed to do. And the reason why you want to slow the spread is so that you have enough hospital capacity to take care of people who might need hospitalization, or those that are critically ill in the hospital and need access to intensive care unit or ICU beds. And so that's the whole reason behind the strategy. So one of the things, again, we want to keep focusing on when we look at the numbers in North Dakota is where we are relative to those goals. Today, at 11 o'clock this morning when we do our daily announcements, this is for yesterday's, the full day Monday, there was 12 new cases out of 490 tests. That's a 2.4% positive rate. That's actually below our both 3-week and 1-week trailing average, which we'll take a look at in a minute. But another number which we want you to also focus on that first slide in is is hospital beds utilized 18. And again, as we work on our health capacity surge plan, we know that we're going to be presenting a plan that has more than 2,600 available beds in the state by the time we get done with our planning. But even with those that we know of, again, this is less than 1% of the hospital beds today in North Dakota are being used for COVID patients. And so again, this should give people great comfort that the strategies we've implemented are working, because the Saving Lives strategy was slowing the spread to make sure we stayed underneath that hospital capacity line, and that's the strategy, and we're executing against it. So again, as we did yesterday, we had a few executive actions that helped us again take smart, targeted actions to slow the spread and flatten the curve. I think for people in North Dakota can relate to the fact that some people have said we're using scalpel, not a sledgehammer. For those many hunters in North Dakota would know that we're using a rifle and not a shotgun when it comes to the decisions we're making. But again, one of the things that we want to highlight when we talk about the success we're having is also pointing to yesterday's presidential press conference, and maybe this could be finally put to bed yesterday with the comments from Dr. Fauci, because there seemed to have been a national obsession with some states that were having similar success to North Dakota but didn't have the label that some of the national press wanted. And Dr. Fauci said after talking to rural states that were doing restrictions on travel and closing businesses and closing schools but didn't have the label that some people were looking for, he said what they're really doing is functionally equivalent, and I want to make sure people understand that. That they have in place a lot of things that are totally compatible with what everybody else is doing. So key operational words there: functionally equivalent and totally compatible. Hopefully that'll put that to bed. We know that in North Dakota, making smart decisions for North Dakotans, we're doing everything we can here to make sure that we're keeping people safe and healthy. And as we've said over and over again, that as governor, I will use every tool at my disposal and all the powers granted to this office to protect the health and safety and lives of North Dakota citizens. But we're going to do that if it makes sense and when it makes sense. Other data that we want to jump through this morning is, again, on the tests, because people sometimes get focused on the numerator, if you will. But even just on the raw number in the terms of number of new tests, 12 today is lower than many of our previous days, and this is with another great testing day with 490 tests completed. When we put that onto the positive test rolling average that we talked about again, today's average at 2.4 was below the rolling average of 3.1, but having basically a flat line here is great news for North Dakota. Each day this is a flat line, gives us more time to prepare for our hospital capacity if needed when that surge might come. Again, by comparison, other states that have found themselves in the midst of this pandemic, both New Jersey and New York had positive test case rates of over 40% this last week. Michigan was in the high teens, and Louisiana also up there well into the double digits. And so again, we are in great shape from the standpoint of how we're trending. We also have updated our slide that talks about cumulative cases to make this easier to understand. There was some headlines and focus around the top line number, but we're really, in terms of how we manage and the pressure we have on healthcare, it relates to the number of active cases. And so above the horizontal line is the number of remaining active cases in North Dakota through today with the 12 new ones. The green line below that line is the number of people that have recovered. So the top line is the net number. That's the number that we have to deal with today. And of course, sadly, this is the disease can be fatal to people that are elderly and have underlying health conditions. So below the line also you'll see a small area there in black, which represents the now cumulative 4 deaths that we've had in North Dakota, and our sympathies go out to those families who lost their loved ones. But of course, part of what we're all doing under the North Dakota SMART is making sure that little black mark underneath the line there stays as small as possible in terms of number of deaths. In terms of county information, there has been some questions about how we doing relative to testing around the state, and we'll continue to push this information out to help people understand on both ends of the state, so whether you're in McKenzie County or you're in Cass County, in terms of number of tests per 1,000 people, they're very similar, and so we are doing a good job at distributing tests around the state and making sure that testing is happening in all corners of the state. And you see starting to see on this some of the results of Saturday's drive-in testing that we did in Amidon and down in Slope County in southwestern North Dakota, where we did end up having a lot of people coming from Hettinger County and Bowman County. We see those counties also showing dark down there because it was very popular, oversubscribed in terms of the drive-through testing, and not all that data is in this yet. I'm sure we'll see testing per capita continue to climb up in Stark County, where Gladstone is located, when all of those results from Sunday's testing flow into these numbers tomorrow. But again, great job to those people that are out there in healthcare collecting, and great job to the labs that are working on getting all these tests processed. So thank you to all of those folks. Next, we've got a very fun announcement. We had suggested that this might be in the offing, but here it is today. We're very pleased that at 2:50 today, approval was given by the Apple App Store to a brand new app called Care 19. This is a way that every North Dakotan can help save lives by downloading the Care 19 app. It takes a few hours from the time it's actually approved to when it's available. So if you're thinking of pulling up your mobile device right now and trying to download it, it may not be available till this evening, but this is a free app, and this is being announced in conjunction with the North Dakota Department of Health, the state of North Dakota, in partnership with Proud Crowd, which some of you that may know were the creators of the Bison Tracker app, which over 15,000 Bison fans have used. And this and again, what we're talking about here is a completely voluntary app, completely opt-in. A person opts in, downloads the app, and then you can interact. You select your geography, select state of North Dakota. You interact with the app, and you can start adding locations like your grocery store and other places you've been. And if you stay healthy for this whole thing, then you'll never need to ever look at this app. If you find yourself in 2 weeks or 4 weeks or 6 weeks from now, you're one of those individuals that tests positive, or you're in close contact with someone who tested positive, you will have an opportunity at that time, if you're contacted by a contact tracer from the North Dakota Department of Health, and when they ask you the questions, which we do, we call up and go, hey, you've tested positive. Where have you been? Who have you been in contact with? And you're like, wow, I'm not sure. I've been a lot of places the last 3-4 days. You pull up your Care 19 app, and you'll be able to provide information about where you've been in terms of locations, and it would track at a granularity if you've been within a narrow distance with someone for more than 15 minutes. So if, say, you're out going for a bike ride, it's not going to track that. If you're walking by, somebody on a sidewalk, it's not going to track that. But if you spent 20 minutes at a grocery store, it'll know that you spent 20 minutes at a grocery store, and it'll help you remember people that you might have come in contact with. And so again, this is a tool that we would look forward to having widespread support. We would love to have tens of thousands of North Dakotans download this and start using this, because this will be a great supportive tool to help protect you, your family, your loved ones, and it'll also help our contact tracers be much more productive. This is a public-private partnership that's going on, and Proud Crowd CEO Tim Brookings, who also happens to be a Microsoft Fellow, Distinguished Fellow, Microsoft Distinguished Technical Fellow, puts you in one of the top technical roles in all of Microsoft globally, and he's based in Fargo. He's available on the line right now, and we're thrilled to have Tim, who's been working around the clock, night and day, and utilizing the years of R&D that went into the Bison Tracker to help us speed this app, one of the first of its kind in the country to come to market, which we know will help perhaps not just North Dakota, but the nation fight this pandemic. Tim?
Hey, can you hear me?
We sure can.
Hey, perfect. Okay. Well, I think, Doug, you did a great job laying the groundwork for the motivation for the app and really the basics of how it works. It's pretty simple in the end. But we've got a slide here that we're going to try to do a demo of the app, but of course, given the nature of the video and things like that, it's a little difficult to do a live demo, so I've got just some slideware here. And so you can see a screenshot of the main screen of the app. So once you go in, you do pick your state, North Dakota, and then the app, once you grant it location awareness, will start watching where you've been. Now, privacy concerns. You never enter your name. You don't enter a password. You don't enter an email. We do not know who you are. When you install the app creates a random number, a 36-digit random number. And any data that gets sent up to our servers is just associated with that random number. And so we don't know who you are. We simply get some positions related to a random number. And so we'll watch in the background, and we use the phone APIs in a really smart way that conserves your battery. But if we detect that you go somewhere and you stop for at least 15 minutes, and then you leave, all of a sudden you will see an item appear in your visited places screen that is the main screen of the app. And then if you go somewhere else for 15 minutes, you'll see another visited place come up. Now, they'll come up initially with the category of unknown, and we would like people to pick the category of the type of visit they made to help jog your memory. Oh, I went to the grocery store, I went to get drive-through, takeout, whatnot. We have categories. So if you click on one of the items in the places you visited slide, it will actually take you, it'll show you on the map where you were, and it'll ask you to select a category. And then, again, the categories are things like home, takeout, grocery store, superstore like a Target or Walmart. There's an other category, for example. And that's all there is to it. Then you've categorized it. And we're actually smart enough that if you say, this was the grocery store, if you go there again, we'll remember that that location is your grocery store. And so over time, the app will learn. And pretty soon, as long as you're going to repetitive places, you won't even have to do any entry at all. So it should be pretty simple. Now, that's clearly the motivation on a personal level. Like Doug said, if you never get sick, you just do this, and you don't use the app when you're done. You just throw the data away, and it's fine. Oh, no, and by the way, there is a section in the About of the app where you can erase your data at any time. There is a side to this that actually can benefit society, and or state government, in that at a macro level, we can aggregate the data, and we can create buckets of people. We can look at how often users went out of the house, for how long, and the nature. If you went for a bike ride, that has zero risk. If you went to a grocery store, that has a small amount of risk. If you're an essential worker and went to work for 8 hours with more people, that's a higher risk. And we can use that data, again, aggregated at a very high level, to inform our decisions, because, of course, the way people interact with each other impacts the infection rate and the spread of the virus. And having that data is super important for things like, should we issue a stay-at-home? Or as we look to hit the peak and then move forward into a future time where we look to reduce social distancing requirements, how can we make those decisions in smart ways? And so by using the app in aggregate, the government can get a feel, the state can get a feel for how the population is interacting and get a better idea for when they can relax those requirements. So I think that's it.
Thank you, Tim. And as Tim said, this is a opt-in, completely volunteer, and at any point in time you can also opt out. It's completely anonymous, no personal information, not your name, not login information, no credit cards, no anything. It's an anonymous 36-digit number that will be attached to the location information, and only if and when you find yourself in that position of either being positive or close to someone who is positive and you need to help, then you can voluntarily choose to provide this location information to our contact tracing teams. And then, as Tim also said, but in aggregate, this is going to help us, again, have the data that will help us maintain an approach where we can use the rifle and not the shotgun, because we'll be able to perhaps show with data how the individual responsibility approach that we're taking in North Dakota is actually working better perhaps than some of the top-down government mandated approaches in other places. And so this is again, great chance for everybody to that is all part of this together to jump in and be part of this. Because this really ties into what we're doing on expanding our contact tracing, and to make sure we talked about it at one prior conference, but to make sure everyone understands exactly what that means and how important that is, and how vital that is to any work to stop the spread of any pandemic. I'm inviting Mylyn Tuffy to join me again to talk a little bit about contact tracing and how we're dialing that up here in North Dakota. Mylyn, thank you for all your leadership, and thanks for being back again today.
Thank you, Governor. And thank you to all the public health workers and nurses that we're celebrating today. In concert with increased testing, we need to have the contact tracing that's done by our public health investigators. They've been and looking at the people that they've been in contact with. A close contact is anyone who's been within 12 feet or for at least 15 minutes, beginning 48 hours prior to the symptoms. So all close contacts are asked to stay at home and are monitored for 14 days from their last contact with the individual that tested positive. This contact tracing process repeats with every new positive case until there are no new patients. If there are no symptoms that show up after 14 days from the last exposure, then the contact is released from quarantine. Cases could grow exponentially if you have an asymptomatic COVID positive person that's out in the community and doesn't know that they are spreading this disease. That's why it's so important that you download the app and keep a record of your close contacts. Thank you.
Thanks, Mylynn. And as Mylynn said at the end, again, if you're not downloading and using the Care19 app that way, again, it's a good practice. We know that many of our health organizations in our state are requiring all of their employees to keep a paper log of all the people they've been in close contact with, because again, this can help speed the discovery and of how the virus might be spreading, and also allow us to help slow it. Because we do have an opportunity sometimes real time during these press conferences to get feedback from those of you that are typing comments in online, we'll answer a question right away, which is, what about Android? This was going to be Apple only, but Android will be coming. We were able to get the Apple approval, like I said, just this afternoon, but there will be an Android version of this app coming soon. I won't, having spent 25 years in the software industry, I know it's dangerous to spitball release dates, but let's just say it'll be here in about a week. That probably means that Tim's not going to get any sleep for 7 days, but we will think that could be what it takes to get up on that platform. Next up, we want to talk about 4 executive orders that we're delivering today. As you might remember, back on March 20th, one of our executive orders was a order directing state agencies to identify state laws, rules, regulations that hinder or delay their ability to render maximum assistance or to continue to deliver essential services to citizens during the COVID-19 crisis. State elected officials and other executive branch offices were invited to do the same. A number of those ideas have been coming forward. We're really appreciative and grateful for all the work that's gone across these other agencies, cabinet agencies, and other elected officials and other branches of government that are saying, hey, what can we do to speed things along? So today we've got 4 in this group. All of these cut red tape, all of these remove barriers that allow us to keep the state moving forward. The first one, which is suspending a pesticide applicator certification for the use of non-restricted disinfectants during this public health emergency. Another one has to do with giving school districts the same flexibility to hold mail-in ballot elections for special elections. We just did this for regular school board elections and for the June 2020 election for counties on an opt-in basis. That was done prior, that you did not have to have a physical location because we had 33 counties that were already doing mail-in ballots but still had to have a physical location. What we learned was that there was at least 2 school districts we knew of that were having special elections, and so this executive order expands to include special elections, not just regular elections. Another one, we know that with transportation down, that fuel consumption has been down, and winter grade fuel customarily had a cutoff date of April 1st, but there is a lot of winter grade fuel that's still around, held by retailers in the state, and so this executive announcement allows that winter grade fuel to be sold through May 20th instead of the traditional April 1st date because of the oversupply due to the travel restrictions and economic downturn. And then lastly, we're suspending a requirement that a school district conduct written performance reviews for every teacher, principal, and assistant or associate superintendent employed for more than 3 years. Written performance reviews will still have to be conducted for those employed for less than 3 years. And key words there is assistant or associate superintendents, modifying superintendent, because superintendent's performance reviews are done by school boards. And so they can continue to conduct their board responsibilities in that way. But this suspension frees up teachers and administrators to continue their focus on providing distance learning to make sure that every North Dakota student receives quality education and provides some flexibility for how these evaluations are provided. I'd now like to invite our state superintendent, Superintendent Baesler, up to explain further why this change is needed. Thank you, Superintendent Baesler, for your leadership, and thanks for being here today.
Good afternoon, everyone. Thank you, Governor. First, I want to emphasize that this decision to request an executive order of the governor on this issue was not taken lightly. At the Department of Public Instruction, we believe in encouraging a culture of continuous ongoing improvement, and regular performance evaluations are an important way to do that, to help our educators become better each year. We all know that excellent teachers are key to student success. However, we must also acknowledge we are going through some extraordinary times. We are asking our superintendents to manage school closings and new ways of instruction. And I believe this waiver is an appropriate way of helping our schools manage the work in their district and prioritize the needs of serving students and families. This order only affects principals and, only affects teachers, principals, and assistant or associate superintendents, as Governor Burgum said. Our locally elected school boards handle the evaluation of our district superintendents' attendance, and that does continue. Our administrators and teachers who have been in their jobs for 3 years or less will still have their spring evaluation. We believe that this is appropriate to maintain the evaluation requirements for teachers and administrators who are new to their positions, so they can continue to gain more feedback and more confidence in their jobs. Our state law already separates the differentiation between these two groups of people. Under current law, teachers, principals, assistant superintendents, and associate superintendents who have at least 4 years of experience are evaluated once. Those teachers and principals and associate superintendents that are in their jobs less than 2 years have 2 evaluations, one due in the winter and one due in the spring. Nothing in this order, however, prohibits or prevents a school district from conducting a written performance review for a teacher, principal, or assistant superintendent for more than 3 years, but it does suspend the requirement, allowing our school districts to make that decision and prioritize their most important needs. Thank you.
Thank you, Superintendent. Insurance Commissioner John Gottfried, who's been a great partner through all this and has been at this podium several times. Yesterday, I wanted this is kind of a verbal retweet of his applauding, but yesterday he applauded the insurance, a number of car insurance agencies around the country, including Allstate and others, are Return of Premium Relief Fund, American Family Insurance, Shelter-in-Place Paycheck, that was the Allstate one. Allstate and American Family and others are returning savings resulting from the COVID-19 pandemic. So this is good news. If you are a customer of either of these two leading companies, customers of Allstate may qualify for a payback equal to 15% of their March and April premiums, payable in April and May. Qualifying customers of American Family Insurance will be entitled to a one-time $50 payment per insured vehicle from the Return of Premium Relief Fund. This comes on the heels of extensions of coverage for customers that were using their personal vehicles to deliver food and supplies during the pandemic. But you can find out more about that at our insurance commissioner's website, which is www.nd.gov/NDINS for ND Insurance. But again, of course, those companies are able to do that because with less driving, there's less accidents, they're paying out less claims, and so they're returning some of those premiums. So great business move by those companies. Maybe other car insurance companies will follow. Next topic. Unemployment, yesterday we had another day, 2,666 unemployment claims filed. That brings the total topping 40,458 for claims filed since March 16th. Again, that is 2 years worth of claims filed since March 16th. Monday's claims include 1,045 pandemic unemployment assistance claims for the self-employed, for independent contractors, and for gig workers. And again, those are a new category of claims. So glad the word is getting out that if you might not traditionally have been covered by unemployment under the new CARES Act passed by the federal government, you can qualify. And so those claims, that was April 4th. I think that was just this last going live a few days ago, 2,568 of these claims for self-employed independent contractor gig workers. It also includes 906 claims for pandemic emergency unemployment compensation, which provides 13 additional weeks of coverage for those that had exhausted their unemployment insurance benefits. Claims in that category going live since April 4th, 2,290. And then last week, you may know, this group especially, because this group pays very close attention, but we had an executive order. We waived the mandatory 1-week waiting period for unemployment benefits. Those programming changes into our aging mainframe have been accomplished, and so very excited about that. And so now the benefit payments can get into the hands of claimants more quickly. And 12,914 weekly benefit payments went out today, and any of those that were filed since March 8th were paid for their waiting week if they were eligible. So we went back to March 8th when this thing started. So the amount of payments going out today from the North Dakota Unemployment Insurance, more than $11 million in payments today. This should be in the accounts of individuals by tomorrow or Thursday, depending on bank processing. Normal benefit payments this time of year would be in the range of $2 million. So more than 5 times the level of payments, $2 million up to $11 million in unemployment benefits going out. So great job to the team over at the North Dakota Jobs Service, which is the group that's handling this, but Job Service, again, the team over there managing 2 years worth of processing in a couple of weeks. Next topic is behavioral health. We want to include a little bit of this every day because, well, we do have our whole of government and whole of state focus on this physical health crisis, the deadly coronavirus. We also need to make sure that as we go through the enormous amount of disruption that's happening in our lives, to understand the behavioral health and the mental health, the stress challenges that are going on when people have undergoing just change by itself, potential job loss, small business owners, farmers, ranchers, the farm stress that's out there. This is a real challenge, but one of the things that as parents we all know that things that are happening right now in school children's lives is that they're missing milestones, and whether that milestone is hey, I'm going to miss my senior prom. Hey, our team qualified to go to the state Class B and we didn't get to play a single game. Hey, what about, I have talked to parents whose first graders and third graders, this isn't just for high school kids, but first graders are like, when are we going back to school? Because we practice and rehearse so hard for that music program. Pageants, I mean, all of these things that were milestones that people had in their lives that they were working for that gave them a sense of direction and purpose are gone. And so when those losses occur, we have to do more than as adults, than to just try to say to people, hey, suck it up or get over it or whatever. I mean, because what's actually happening in the process is real grieving. I mean, there's real grieving going on, and it's important for people to understand that, parents especially. And so again, at our behavioralhealth.nd.gov, we've got resources. parentslead.org is another one of our sites, but we encourage people particularly if you're, have time, you're working from home, you're dealing with all these additional stresses that can lead to increases in addiction, drug use, domestic violence. All of those things are likely to be on the rise, and we want to make sure that we're that we're reminding people daily that while we're doing great work against this physical pandemic, that there's work to do every single day to make sure that we're taking care of people's mental health, their behavioral health, and their spiritual health. And we are thankful for all the people that are working hard on that part of the equation. With that, we'll stand for questions. Dave Thompson from Prairie Public, radio legend.
Well, I was just wondering, the people who file for unemployment, are you keeping track at the state level of those who are approved and those who are not?
The answer is yes, I'm sure we are. With the amount of flexibility that's been given and some of the waivers that have put in place, I'm sure that we're seeing record low denials, is just my guess, but that's me guessing, but we can grab that information and have that back here, or get it to you, Dave. I'm going to go to Lane from KX News, and then we'll go to one online.
Governor, last week, I believe it was on tests from Thursday, there were over 800 tests taken. Now back to today, there was only 490. Is there a reason why the numbers are jumping back and forth?
Some of the numbers relate to providers. Because again, if we're doing a drive testing like we did on Saturday and Sunday, where we did 367 and 368 at the two different locations, the state is driving that. The rest of the number of tests given is providers. I mean, test kits are out there at clinics and at hospitals around the state, emergency rooms where, again, if you feel you need a test, call before you go in. Don't just show up in an emergency room. But, a provider is making a decision, but we're making sure that the tests are out there. We would like to see, as long as testing supplies last, we want to encourage people to continue to do testing. We want to see those numbers go up, but we have no reports prior to walking up here today of any place that's out of testing kits. So some of those variances are based on either demand of people coming in or the choices of providers going out. The work that our lab team has done with the two Abbott M2000 machines, which were both set up and verified over the weekend, should give us the capacity. We're also have gone to more shifts a day. We're looking at a plan to run the lab 24 hours a day with support from the National Guard to keep that going around the clock. And if we do that, then we should be at the ability to do more than 1,000 tests a day. So we'd like to see that number continue to climb. And again, that's the numbers that we're giving you are the tests that are completed coming out of the lab. Could have been a higher number, like on this weekend, of test kits that were gathered, but then they come in, they get queued, they go through. But again, we're talking about tests completed, and we've got our lab at the state lab. We also Sanford lab in Sioux Falls is processing North Dakota tests, and we did have some tests that were being processed at Mayo last week because Mayo had some extra capacity in Rochester. So we were utilizing 3 labs last week when we had that high test day, and we'll continue to try to create as much lab capacity as we can. But some of that was, like with Mayo, was before our M2000s came online here in North Dakota. We're also, again, confirmed yesterday that I mentioned this, but there's 15 ID Now, Abbott ID Now machines. Those are the rapid testing machines that they're on their way to North Dakota, and they should be arriving here within the week as part of that federal allocation to the states. Question from online?
Scott Hennon with WZFG KFYR Radio. The city of Fargo and West Fargo have announced that they will be directing people to stay at home when possible. Do you feel North Dakotans at large are following the state and federal guidelines?
The answer is yes. I feel that for the vast majority of North Dakotans are following the guidelines, and I understand. Last night we had a great conversation with the mayor of Fargo, the mayor of West Fargo, so Mayor Mahoney, Mayor Dardis, Cass County Commission Chair Chad Peterson, hour and 15-minute call. I think we're all on the same page in terms of what we want to accomplish. I think there was a lot of confusion for a few hours this morning in Fargo before the actual press conference occurred. My understanding of a readout from that is that what was delivered was support of the direction, both the federal direction and the state direction in terms of everything we're talking about under the ND SMART approach, the stay home, stay healthy, stay connected, and again, reinforcing that from the mayors to say that they would like to see everybody being complying. I know that the Fargo Park District has put out some of their own guidance as well as how to make sure to maintain physical distance when using the parks, because we've had a big increase in usage of parks, which is great. But when we're there, we got to stay separate. But we appreciate the support of the mayors supporting and advocating for what we've been saying here at the state for some time, and so that reinforcement we appreciate. But as my understanding, there was no change given at the local level that's different than what the guidance that we've been providing here at the state level.
Governor, I think this might be a question better suited for Mylin, but basically the Department of Health confirmed to us today that the quarantine order from about 9 or 10 days ago now applies to travelers returning from Minnesota to North Dakota. Obviously that's consequential for people who live along the border. I'm just wondering if that order has been enforced or if there's a plan to ramp up enforcement.
Mylin?
As we said, the enforcement happens at a local level, and Minnesota did hit the list from a widespread community disease perspective. We are looking at revising that order to make it more clear that essential workers are free to go about their business and practice within the state under the conditions of their employer.
Let me just concur what Mylin said is there's when we had the travel order, we were listing hot states. Minnesota wasn't on that. If they've been added to that list of states, we will make sure that that gets amended because we know there are a lot of healthcare professionals and other essential workers, for example, that live in Moorhead or East Grand Forks that work at hospitals in North Dakota. And we also know that there's a lot of patients that come in. As we've talked before, when we're doing our surge planning, we have to plan for 30 to 40% of those beds in Fargo and Grand Forks to be occupied by people from Minnesota, and we're not going to be restricting individuals that have received their care in a North Dakota hospital that have traditionally worked with a North Dakota provider that are from Minnesota. We're not going to be restricting them coming in. So we'll make sure that we've got in some cases, how healthcare is delivered regionally sometimes doesn't match up with our borders, and we've got to make sure that we're flexible and nimble with the orders. And so, as Mylin said, we'll take a look at amending that so we're not creating any problem for our border metros. Jacob?
Governor, a number of coronavirus projection models have adjusted North Dakota's peak day from April 21st to April 17th, and that lines up with the projected national peak day of April 15th. We've been talking a lot about North Dakota spread being slower and a few weeks back from the national average. Does this new projection model affect how the state is going to prepare?
Well, I'm super happy you brought this question up because we've been trying to reach, if the model you're referring to is the one, the IHME model, been trying to reach them since yesterday morning because they're inputting somebody else's state's data into North Dakota. So this is the challenge why during this whole pandemic is this is meant to be a trusted site. We've reached out to the senior most people affiliated with that organization to help them understand the urgency of getting this restated. But we have 4 deaths in North Dakota, and if you look at you can download the data from that. You look at the last 2 days, they got 17 deaths and 9 deaths in there. So it's not even anywhere close. The restrictions, there's 4 level of restrictions that have fit their model. Have we restricted travel? The IMH model says no, we haven't, when in fact, yes, we have. We just were talking about that. But whether it's for incoming travelers, have we, closed non-essential businesses? Yes, we have. Their model says, no, we haven't. The only thing they've got right is that we closed the schools. And so that is there's each time that those yes or no questions I'm describing, that flips a variable in the model that makes things look worse than it is. And so getting both the variables fixed and stop inputting some other state's data, we'll be interested to see what that model is, but I'm going to guess before they changed it on Monday morning, we were actually tracking ahead of their prior projections because they had projected that we would have more than 4 deaths by yesterday, and we had less than 4 deaths, or we had 4 deaths, so we were tracking ahead, and then suddenly we're behind. Kudos to our whole team who has been taking regular screenshots of these national models twice a day so we can, rather than trust, we can trust but verify, and then we're working hard to get to them, to get those changes connected, and I'm hoping that that'll happen before the sun sets tonight because we've been on this for the last 24 hours.
If I may follow up off that, you talk about making data-driven decisions, then what does your data say?
Well, I think with the data that we'd be looking at is, again, we got to look at multiple models. We're building a model for North Dakota. We were looking at the IHME model closely, which is why we instantly spotted that it was wrong. There's another model out there called the Act Now model, which we think is way off on that one. I mean, that is not sure what data they're using. So there's lots of different models, but one of the things that none of those models have is how many people that are actually hospitalized today, which is the number we let off with yesterday and today. With today, we've got 18 people hospitalized in North Dakota. And the whole strategy of what we're doing is try to make sure that we stay under that needed hospital capacity. That's how we save lives. And so that's, in the end of the day, we're going to have to look at make our own decisions here in North Dakota with our own on the ground truth. But some of these other national models are helpful, but the ones that are out there, we want to make sure that they're accurate. So that's why we're working to get that IHME one fixed ASAP. Another question from online?
Matt Henson with WDAY. With Minnesota added to the CDC list of states that we require quarantine when traveling from, say somebody lives in a border city and crosses into Minnesota, say for takeout, do they have to self-quarantine when they come back to North Dakota?
Because we answered this question earlier, we're going to make sure that we add exceptions to our rules so that that doesn't happen. I mean, we know that there are people as just part of the regular course of business have to traverse back and forth across the border. I mean, if you're a doctor that lives in Fargo and you work at a clinic in Minnesota, no, we don't want you quarantining when you come back from work at the end of the day. So we'll, and the same thing, I mean, we keep talking about Fargo-Moorhead. The only hospital in Wahpeton is in Breckenridge. So again, if people want to go to the clinic or hospital in Breckenridge, they're not going to have to isolate when they're in North Dakota and coming back home again. So we'll have to make sure that we've got exceptions for border cities that erase the confusion that would be that is being created by Minnesota being, and let's be clear, we didn't put Minnesota on the list. We had an executive order that said it applied to states that were considered hotspots, and then Minnesota popped onto that list today, and I don't know, it's interesting they got on their positive case rate per test is almost identical to North Dakota, and so it must have been some aggregate number of total tests or something that triggered them getting on that list. But there's nothing, Clay County's not endangering Cass County, and Cass County's not endangering Clay County. The infection rates are the same on both sides of the river, and we'll continue to treat those metro areas as best we can as metro areas. Okay, I'm going back to Jeremy, then to Dave, then to Jacob.
You talked again today about contact tracing. Is there a point at which the Department of Health would consider abandoning contact tracing? Obviously, that's happened in states where the rate of infection is a lot higher.
Yeah, there's a point when you would abandon it, but we're not near that today. Not when you get 12 people out of a state of $760,000, we should, people, 760,000 people, 12 positive tests. I mean, we should be chasing down every one of those positives as hard as we can to find out who they've been in contact with. And I think you saw this even when we were talking with the mayors last night. I mean, we had in the cases in Cass County yesterday, of the ones that had been finished the processing, 6 of the 8 that had been finished were close contact. Well, if you're saying, whoa, we had, 6 more cases in Cass County, well, and they were all family members living with somebody else, well, with our executive order yesterday, they're all quarantined. That's very different than if we said, oh, we got 6 new ones and they came from community spread and we have no idea where they've been or who they've been in contact with. So again, our approach of, dialing up our testing, which we've done, getting after those positives with contact tracing, the quarantine of positives and people who reside with positives is the rifle strategy that's going to allow us to slow the spread with the least amount of government mandates on everybody else. So testing and contact tracing are like a great quarterback and a set of great wide receivers. They go together. You can't complete a pass without them, and we need to have both of those. And that's why our contact tracing team, I think we've got close to 250 people that were trained up, but we're trying to get that number to keep growing and growing as well, so that we've got, even as we grow in case counts, we can still put that ample strategy. And with tools like Care19 that we today, then sometimes these calls, when we make a call, person's making a call to do a contact tracing call might last 90 minutes, and then you say, well, this person said that you were by them. You call them, it takes an hour. Well, pretty soon you've got one person over the course of the day is, talk to 7 or 8 people. We'd like to speed that up, and one way to speed that up is with people being able to have the data to actually have better than our own memories of where we've been and who we've been been on. And given that we're just all about real time here, I'm getting flashed a message on the screen. Just confirm the Care19 app is live on the Apple App Store. So, belegendary.link/Care19. It's live right now. It's there. Wow, that was fast. That beat the release date by hours. Amazing. Good job, team. Way to go, Care19 team. Okay, who's next? Was it Dave?
Surge level 3. I think I must have missed it somewhere. How did University of Mary get chosen over BSC? And are you going to have more details about level 3 later this week?
Answer is yes, we'll have more details on level 3. And part of that will explain the UMary versus BSC. But I think part of that was driven, again, my understanding is driven by UMary being really proactive and wanting to help and volunteer, that was an effort that they were making. I don't think and again, our goal on tier 3 is nobody sets foot in a tier 3 minimal care facility. Our goal is to manage this thing so we can take care of patients within the walls of the hospitals that exist in our state.
Is NDSU still considered a location, perhaps?
Well, NDSU is definitely going to be part of the equation, but in the same way as part of this rehearsal planning, there have been some beds staged at the Fargo Dome because that's been used as a facility, I think back during the 2009 or 2011 floods has been used, but we're taking a look at again, at our universities, and again, whether on that surge, and then when you get to that level, if you got to the case, or if you're like a New York or New Jersey where things are really spiraling, not only do you need places to care for the people that are sick, but the volunteers that are supporting them also need isolation as well. And so again, that's where dorms or other places may come into play. We've had a number of hotel operators that have said, hey, if you need rooms for volunteers or people to be isolated, or if you got family member that's sick but other family members don't want to go home and they need a place to stay. I mean, part of it is keeping people separate. Sometimes you need more housing. That all comes in that tier 3 surge planning. Jacob?
Governor, for the viewers who can't see this, in this room there are a few state employees and some of your staff members wearing masks, but you and the Lieutenant Governor are not. Wondering as to why.
Well, I think we're trying to dial up that practice of wearing masks when appropriate. And I'm certainly grateful for people that are dialing up and doing that. And it can be awkward to communicate wearing a mask. So I know that some other governors wear them and then take them off when they get to the podium. I think it's good role modeling. But it is what we're trying to also do, the Lieutenant Governor and I, is make sure that we're staying more than 6 feet away from each other and not having close contact, away from each other and away from our staff. So we've got even our internal meetings, have a lot of our internal meetings today and briefings that we're having are done by phone, people dialing in. So we've really reduced, and as you can see from the parking lot, there's very few people in this building. Spacing is pretty easy right now because there's got a large facility with very few people coming to work.
Wear a mask when you're not on the phone or speaking to people?
When I'm not on the phone and not speaking to people, then I'm not around people. So I mean, I'm not. And again, you don't have to wear a mask, or if you're in close contact, like when the First Lady and I are together, we're not wearing masks when we're hanging out in the evenings because we're already exposed to each other, and so that's I would say the more exposure I can get to the First Lady, the better. So we'll just say that's a good thing. Maybe that came off wrong, I don't know, but I'm grateful for her support. She has been amazing through this whole thing. She's been incredibly amazing. So this is the most amount of time she's ever had to spend with me, I'm certain, in her life too. So because this is neither of us have we have busy travel schedules that take us in different places, and we've been together here since this whole thing started. So I'm super grateful for her and grateful for all the prayers that people have for us. So thank you. Online question.
April Baumgarten with the Forum of Fargo-Moorhead. You'd mentioned previously that Appareo Systems is working to make ventilators. When can we see those coming online? And has North Dakota had any success in finding ventilators and PPE from other sources, including other countries such as China and New York?
I know that Appareo is running hard. I know that South Dakota has also placed an order with Appareo. I know that our state's placed an order with Appareo, and I know that our surge team, if we have that update here this week, is going to include the updates on equipment. But right now, we feel like we're well positioned in terms of the PPE and the ventilators and the staffing we need. And so our team continues to work hard on sourcing, but we don't see any issues there. I know this has been in the news, a lot of news about the national stockpile and ventilators and governors sending ventilators back and forth. But right now in North Dakota, we're feeling like we're in pretty good shape today, but we continue to work all those numbers, but we don't see that as a risk area today. One more again online.
This one's for the Superintendent Basler.
Yay.
Thomas Simon with Williston Trending Topics. What are you hearing back about the distance learning progress now that we're into the second week of it?
So the question was, what are we hearing back about the distance learning projects and how our distance learning instruction, now that we're a week into it, and how is it going? Actually, very positive feedback. As you all know, I have a student cabinet that I meet with, have now been meeting with weekly, as well as a family cabinet that I meet with every Saturday virtually. Had a call today with principals, and we'll have another one tomorrow with superintendents. And so we've heard lots of feedback, and actually today we were a little nervous because the phones were pretty quiet comparatively from the last couple of weeks, and so we're wondering if the other shoe is going to fall. But with that, we've heard that there are some challenges. Technology has been a challenge, not in so much in the bandwidth. I mean, we're so grateful in North Dakota. North Dakota, I think, leads the nation in our ability to have our students connected. In fact, working with Dakota Carrier and our Broadband Association, we have less than 0.2% of our students don't have broadband connections right now, and they are working to get those households connected as well. So the technology connection is going very well. I think it's just everyone settling into a rhythm and a cadence and a routine. I think those are the things that our students are struggling with. Our teachers are getting calls at 6, 7, 8, 9, 10, 11 o'clock at night because there's a different sort of routine and schedule. So I think it's more about the adjustment of daily schedules than it is with the instruction. But our kiddos are doing well. Our teachers are doing a fabulous, remarkable job of getting the students the support that they need. And our family members are really struggling, are really stepping up as well. Some of those family members are also telecommuting employees. If you have a mom and a dad in a house, they are probably telecommuting to their work and now managing the facilitation of 2, 3, 4, 5 students in the house. So everyone is really stepping up and being a true North Dakotan and making sure that they're just making the best out of a situation. So we've informed all of our school districts that if they have put something in the plan that they submitted to us and that they approved, that if it isn't quite working the way, everything looks good on paper and the implementation looks a little different. So we've assured all our school districts that if that's the case, that we're here to support them and help them work through those situations and to not be afraid to shift and adjust and adapt. Our teachers have always been the entrepreneurs that they are in classroom, and now they're just taking that online into a new way of instruction. So thanks for the question.
One more online.
Jean Schemp with Hometown Radio Group in Minot and Bottineau. There are some North Dakota workers who had their hours cut way back rather than being laid off, and because they haven't been laid off, they can't file for unemployment. Is there any programs or options available for this segment of the population?
For Jean, I think the answer is yes, because they should check specifically again with North Dakota with the Job Service or call our Department of Commerce, because I had heard that there were some parts of that federal legislation, the rules they're working on did include people whose hours have been cut back. So they should check on that. And for my team, we can, if it details here, we can bring that forward at a next conference. Lane?
With any major event like this, there's always those troublemakers that try to cause more panic than there needs to be. What would you say to those people that are causing more issues and panic than there needs to be?
Well, I think there's, two categories here. There's definitely, again, I would encourage all North Dakotans to make sure that you've got, trusted news source. There was based on the number of calls that we got this morning here in our office, there was a, flurry of activity, and I'm sure there was people rushing to grocery stores and loading up and doing whatever in Fargo because there was, there was all this, hey, there's going to be issued this quarantine for the city of Fargo or stay at home. And what it was, the difference between a directive and an order is a big deal. I mean, a directive is guidance, it's encouragement, it's support, it's please follow the rules. It's like, thank you for all the people that are. An order is very different. And so, again, when things start flashing across like that, they can quickly, in this environment, things can really go. So I think it's important that that people are, understanding and they're on the sources of their information, and then they're also, we learn as leaders to make sure we're precise about the guidance we're giving, so we don't create undue excitement when we don't need to. But when you use the word, I don't say troublemakers, I think want to maybe just close with some thoughts about what we announced yesterday and the importance, because one of the things that saddened me today, and I understand it, I mean, all of us were teenagers at some point, and when I was a teenager, we didn't have a global pandemic, so I can't relate to what that would be like, to be missing your, spring track season and not being around your friends, et cetera. But we did have a verified a report of there was a family that had a member that had been traveling that tested positive, and, teenager sneaks out of the house and goes to a house party, That could be an innocent thing, or it could be that, dozens of other people get sick because someone without symptoms could be transferring that, and then one of those other kids has got a living situation where they're living with a vulnerable elderly adult, and someone gets this and dies from that. And so I think when we talk about individual responsibility at all ages, it's important, even for the young people who may feel really cooped up and really challenged by this whole thing, to understand in a world where we see so much desire for social responsibility among that generation. I mean, one of the biggest elements of social responsibility right now is to understand and follow the rules. And of course, it's not just follow the rules, it's no longer guidance. As of yesterday, if you are a household member, even if you're not related, if you are, share an apartment with 3 other college students and one of you tests positive, the other 3 of you that lived in that household unit are under the quarantine order from the state of North Dakota, and that is now has the force of law and is punishable as a misdemeanor with a fine up to $1,500. So this is a thing where I want to just reinforce what we did yesterday, the rifle approach of making sure that we're doing a great job of identifying positives with increased testing, following with contact tracing, and anybody that's close to them, which specifically means people that are living together, that those all follow that isolation. It's not a please self-isolate for 14 days. It's a mandatory 14-day isolation. If we do that, we're going to be in great shape. So that, I think, is, I don't think I would really call that a troublemaker. I think I call that we need to be really thoughtful about how our actions can affect others. And if we really want to save lives, then we got to pay attention, because this is new to all of us to do that. And again, for folks that maybe enjoy sitting at home and fanning the flames on social media, it's I mean, maybe that's what they feel they got to do right now. But I would just say, you can do your part too, because I know for all the people that are fanning the flames, there's a lot of people that get on their keyboard and deliver messages of support, positive messages, ask people to make sure they're checking the facts and steering people to the right sources. But for all those balancing, those that are balancing those tendencies, we say thank you. So as we close today, as we do with gratitude, or maybe one other thing here from the masked Nowatzki here. Okay, wow, okay, so the masked Nowatzki, that's masked Mike right there. I will disinfect this phone after I hand this off. But Tier 3 question, okay. BSC was very willing to collaborate, very willing with capital V V and underlined, very willing. When the National Guard and I think Army Corps of Engineers saw the size of the UMary athletic facility, they decided to go for that scale, and so so that was part of that decision, I guess, was just the amount of square footage in the room, because when they're doing the scouting for those Tier 3 locations, they want to make sure that they can get the right kind of distancing. The app is up. I was going to show it to you, but now the app is closed, and my Face ID does not work on Mike Nowatzki's phone. But there are 670 installs that have already occurred. Okay, it's Mass Jody Hansen doing that coming in. Okay, there's the app. Now you can see it. We're holding it up like, look at that. We got there's already pockets in Minot, Bismarck, and Fargo that are happening, and that are there, and those dots are starting to fill in all around Williston, Dickinson. It's coming all over the whole state. So people are just that fast. 670 downloads. Way to go. It's probably higher than that already. So way to go, team. And thank you for doing your part on the CARE 19. So as we close with gratitude, as we do, I just want to again say to all the people that are following the rules, all the people that are paying attention, all the people that are doing the great job of parenting, all the people that are looking after their loved ones, anybody that's written a note to somebody who is in a long-term care facility that now can't receive visitors. Again, whether you've done an extra phone call, a handwritten note, a gift package, whatever you've done, I just say thank you for all the kindness, the patience, the generosity, and the emotional support that you're providing for each other right now, because that's as important as the physical distancing and the staying healthy, but it's also about staying connected. So for those of you that are putting extra effort into staying connected, thank you for doing that, and because your efforts are why we're seeing the great numbers like again we saw today. Another great day for North Dakota. Thank you very much, and stay healthy, stay home, stay connected.